now, Governor Bill Lee giving an update on the state of COVID-19 here in Tennessee. Let's listen in live.
Facility to pursue following CDC guidelines where possible, to utilize best practices to mitigate the spread of disease even in child care facilities. We're doing that by giving them guidance and suggestions on hygiene in their facilities, and they can get this guidance through the Department of Human Services. We're also encouraging them in the ways that they keep children separated from one another as much as possible and only congregated in small groups whenever that's possible. So we're giving guidance to our providers, but we're also loosening the restrictions that we are putting on these child care providers, the regulatory burden, to make it easier for centers to provide child care for the numbers that we expect will be entering the child care rolls in the weeks ahead. We're maintaining a safe space for children while at the same time dealing with a temporary situation that is putting more kids out of schools and into child care across Tennessee. We're temporarily suspending inspections in child care facilities that we currently do inspect and are under the guidance of the Department of Human Services. We are guaranteeing child care facilities that currently receive state subsidies that they will continue to receive those subsidies even if their business declines as a result of this, of the effects of COVID-19. We are putting out in the next week, or we are planning to put out guidelines for how we will distribute $10 million in COVID-19 emergency response grants. These grants will be used to help child care facilities that are currently serving Tennesseans but that are having to adjust based on the changing environment out there in the child care world. These facilities that are having to make those adjustments, this $10 million will help them make those adjustments, and we'll be pushing those out through grants as administered and given out by Department of Human Services. And finally, I want to say that I mentioned yesterday that I want to encourage Tennesseans to engage in this issue of child care across our state. We have great needs, and families are faced with great dilemmas around the issues that present when schools are closed and their children come home. So again, if you are a church, I encourage you to adopt a school and the families in that school to help in any way that you can to alleviate the burden through this transition period. If you are a neighbor out there and you see a neighbor in need who has lost a job or has sudden child care needs, be a Tennessean, engage with those around us, and together we can alleviate some of the problems that will face us in the weeks ahead. Many in our community are going to need emergency assistance in the event that they might lose their jobs. This assistance can be had through what we call Temporary Assistance for Needy Families, or TANF funding. We are changing the rules around accessing TANF funding for those who lose a job as a result of the economic changes that are happening in Tennessee as a result of the COVID-19. We will be providing up to $1,000 for a family of 5 who have experienced a loss of a job and who qualify for TANF funding. We're working with federal government on SNAP regulations, which is supplemental nutrition assistance program for those who qualify. We're working with the federal government to provide easier access to SNAP funding, and we will have guidance from the federal government hopefully within a couple of days, and we will provide Tennesseans with information on access to SNAP funds. By the way, all of these items I'm talking about, whether it is help with child care, help with TANF funding, help with SNAP benefits, we encourage Tennesseans to go online through the Department of Human Services to find out information about these. The quickest way is not to go to a center, but is actually to go online. It also allows us to serve the increased number of customers that we'll be serving, or that we anticipate serving in the weeks ahead. I want to talk for just a minute about the Department of Labor and the targeted efforts that we're making to provide help for those who may lose their jobs in this economic downturn that we're seeing as a result of COVID-19. We certainly know it's happening. We hear about it every day, and we want to be a part of that solution. The Department of Labor is working with economists to try and anticipate just what those numbers might be, how many folks might be losing their jobs over the next weeks. We know there will be some. We know there already have been some. So we want to work to alleviate and to mitigate that problem as much as possible. We have in our state what's called an unemployment insurance trust fund, and it is in effect a savings account for times of economic trouble. And it's unemployment benefits that are available to people who lose a job. So we're making some changes in our unemployment insurance trust fund. We will be providing unemployment benefits for those who lose a job as a result of the economic downturn, but we'll be also providing benefits for those who are quarantined by a doctor and who will be out of work for a period of time, temporarily suspended from their job, and will be going back to their job. Those benefits had not previously been available, but they will be available now. We will be working with the federal government in what we believe will be an announcement in the next couple days to temporarily eliminate job search requirements for those who are eligible for unemployment insurance through the Unemployment Insurance Trust Fund. And we have suspended rules that, previously it took approximately 3 weeks to get your first unemployment benefit payment, but we have suspended rules that will decrease the wait time and allow Tennesseans to get paid faster, those Tennesseans who do qualify for unemployment. So we've changed the regulatory rules around our trust fund in order to get people paid faster who have lost their job. Again, we encourage those who believe that they may qualify for unemployment benefits to go online with the Tennessee Department of Labor and find the process necessary in order for you to do that. We want to make it easy, and as easy as possible, for Tennesseans who find themselves without a job suddenly to access that trust fund. We also recognize that this situation places a particular strain on local governments and local municipalities. And many of the ways that the state can provide funding for its citizens, the local communities, local governments, and local county governments know even better how to provide benefits and assistance for their own communities. And to that end, we are proposing in the budget, in our amended budget that we will be providing to the legislature tomorrow for their review and approval, we're proposing $200 million to be distributed through grants, which will include the opportunity for counties and cities in every county and in every city across the state to use those $200 million, not only for infrastructure needs and for previously determined requirements for their counties and for their cities, but also for needs associated with COVID-19. We initially had suggested in our budget $100 million to counties. We've added $100 million more because we know that local governments know better than we do what's needed in their local communities, and this will allow for relief for citizens in cities and counties all over the state. By the way, we'll be working with the legislature, and we've worked with the legislature hand in hand over the last several days to make adjustments to our budget, which we're trying to finalize and we'll have finalized for review for the legislature tomorrow, and then they will have a process in which they will vote on that budget. We have an obligation in our state to provide a balanced budget constitutionally, and we will have that provided. We will have that delivered, and I believe the legislature will act on that on that budget, and that budget will allow for much of this funding that we're talking about, whether it's temporary assistance for needy families, supplemental nutrition assistance program, food programs for children that are in schools, additional funding for for child care across this state. There will be a number of programs that we will continue to roll out and that we will continue to give information on in the days and weeks ahead, and this budget will provide that assistance for those folks all across the state. I'm going to ask, we're going to have questions in a minute, and I'll ask Department of Health and Department of Human Services and Department of Labor and Workforce to come with me to ask questions, but I want to say one more thing as I close out this portion of the comments. And I said this yesterday, and I want to reiterate it. I want to say it every time we get before Tennesseans. This is up to us, and by us I don't mean the government. I mean everyone, the state of Tennessee, local governments, nonprofits, churches, community organizations, but most importantly, it's up to individual Tennesseans to mitigate the spread of this disease. It is the little things that will make this happen. It is covering your mouth and washing your hands and staying home when you're sick and not going into places where there are crowds of people and staying in your home whenever you can. It is making the personal sacrifices that will save lives in Tennessee and that will lessen the economic impact that COVID-19 will have on every one of us and on all of our neighbors across this state. So I encourage you to engage and be a part in whatever way it is that you can. If you used to go to a restaurant that you don't feel like you can go to anymore, order takeout. Allow that restaurant to continue to stay in business, but make it safe by ordering takeout. I think that would be something that many Tennesseans across the state can do. There's a blood shortage in this country because of a number of reasons why those facilities are not receiving the blood that they normally do. Get out and donate blood at your local Red Cross or other facilities that accept blood. You can do that safely in this state, so I encourage you to do that. Work with your church to provide services for those in your community that find themselves in need. We already talked about child care, but there are many other ways that you can serve your neighbors. We can together accomplish the things that need to be accomplished to slow the disease in Tennessee and to serve our neighbors in ways that Tennesseans are used to doing and always have done and can step up and do again today. And finally, I'll say again to Tennesseans, pray. Pray for the citizenry of this state. Pray for your neighbors who are particularly negatively impacted by what's happening for them around them. And pray for those who have to make decisions for wisdom and discernment, that we do so in a way that slows the spread of this disease and helps Tennesseans from one end of the state to the other. We will be happy to take questions now. If you all would step up to the stage, we'll answer questions.
Governor, last week you announced that 11,000 employees, state employees, would be able to have the opportunity to work from home. What about the remainder 30-some thousand employees? I've talked to some state employees who said they haven't gotten any guidance lately, at least since Friday. Are you eyeing, asking people to not show up to work? What are you looking at?
So we made that announcement on Friday to give 11,000 workers the opportunity to go home, and we are. That's been about 3 days, and we're now developing a strategy for what additional workers can go home. We've actually asked every department on Friday to provide information on how it is that we can continue to expand state employees working from home. So the first wave was done on Friday. We've asked for a second wave plan, which we'll be receiving, and we expect that many more state employees will be able to work from home.
And then a quick follow-up. state employees in other states have been directed not to travel out of state. Do you have a similar directive, or do you plan on this?
We've asked I don't know the directive for certain. I could probably get some clarity on that, but I think our directive to employees on Friday was non-essential travel, period. So in-state and out. We've actually directed state employees not to participate in non-essential travel.
Governor, you said yesterday that the state has the capacity to conduct thousands of tests a day, but the Department of Health says it only has 500 capacity for 500 tests. Right. What's the contradiction there, and when do you expect the state to be able to put thousands of tests in place of that?
Between our private partners and the Department of Health, we can currently test thousands of people in the state of Tennessee. So that we don't ask them to report, but we know that Vanderbilt, for example, has the capacity to test 1,000 a day, that we have the capacity to test, I believe, Dr. Piercy, 900 a day. You may address this, but we have multiple private providers across the state, which is why I said yesterday that we can test thousands of people a day, and we don't have thousands of people presenting to be tested. So between our partnerships with our private providers and ourselves, we do, in fact, have that.
So you said
Andy?
I'm sorry.
No.
Capacity to test thousands a day.
That's correct. We have the capacity.
Right now, you're only testing hundreds.
Right now, we're only testing hundreds, and we really don't know exactly how many we're testing, and here's why. Because if someone asks their private physician who directs them, who takes a sample and sends it to a private lab, we don't require those private labs to provide us with negative tests. So it's not helpful for us to know how many people are being tested. What's most helpful for us to know is how many are testing positive, and it's helpful for us to know that people are not being turned away. So as long as we have capacity and we have the information on who's testing positive, then we can take the action steps to mitigate the disease. So we don't know how many thousands of tests are available or how many tests are being performed that turn up negative, because that information is not helpful.
But you feel comfortable with the capacity of the state?
We do. We do. And as I said yesterday, on a call to the White House, millions of tests are being pushed out over the next 2 weeks, and we're not anywhere near the place that we need to have thousands of tests a day, even though we have them available. So we feel confident. I'll let Dr. Piercy speak more about those numbers, but we feel good about the capacity for testing. Andy.
According to information you just distributed, you got remote testing sites in 12 counties, including Williamson and Davidson County. What's going on in Hamlin County? What's going on in Knox County? What's going on in Shelby County? Those are the other three big counties. Why can't they have their stuff?
Well, I think they'll have them up. I don't think they'll have them up quickly. This is changing rapidly, and I believe the first remote site was opened maybe on Friday. So we're 3-4 days into this and have multiple sites across the state. I think 3 or 4 days from now, we're going to see multiple sites in every major metropolitan area. And this is a function of private providers. So, the folks that are bringing this online are our private hospitals across the state. And they're doing an incredible job, frankly, of pulling up and standing up remote sites in a very short period of time. There are a lot of states that don't have drive-in testing at all. So I think we're going to see them spread all across the state. And it's really an issue for private providers who are putting these facilities up. Jonathan.
Governor, with the $200 million for local governments, I know you have 100 that's already accounted for through your proposed budget before. Where are you getting that extra money from? And just as a general sense, with how projections are going now, is there any sense you might have to go into the rainy day fund at all for this upcoming budget?
We don't anticipate tapping into the rainy day fund. In fact, we anticipate that we'll be putting funds into the rainy day fund to prepare for a potential economic downturn that's coming in the future. So We're adjusting our budget right now. The way that that's primarily going to be adjusted is by significantly reducing the amount of proposed spending on non-essential items across the state, and that reduction in spending will create opportunities for investment in reserve funds and in emergency funds that we anticipate using over the next year. There's a lot about the next year that we don't know, but we need to be prepared. And let me just add, too, that I'm encouraged that we have funds built up in our unemployment trust fund, for example, that's going to provide unemployment benefits. Because of the strong economy for the last several years, that trust fund is at an all-time high for us, and that allows us to provide benefits today. Our TANF funds are at an all-time high in our state, and we expect that there will be a significant need for TANF funding to provide assistance for needy families in Tennessee over the next months as the economy declines. We have put in place, we've been very conservative in responsible fiscally in our rainy day fund, and we'll be glad we've done that as we enter into economic downturn. We don't know how strong this downturn is going to be or the duration of it. We certainly hope it's short-lived and not severe, but we want to be ready for it. So that's where the $100 million will come from.
Governor, how's your hospital bed capacity? And with so many rural hospitals having closed in the state, is there a thought to using those in an emergency like this?
Yeah, I will actually step back and let Dr. Piercy answer that question specifically, but I will tell you that we've been working for a couple of weeks now with the Tennessee Hospital Association and others in thinking ahead about how it is that we can provide more hospital beds. So you can do things like put off elective surgery and clear beds in your existing facilities, but you can also utilize a rural hospital that has beds that aren't being utilized or has rooms that aren't currently being utilized with beds. You can expand your capacity there. So we're talking with providers all over the state to look at how it is that we can expand our bed capacity. You want to add to that?
Thank you, Governor, and thank you for that question. The Governor's right. We do have somewhat of a tiered approach when we talk about levers we can pull to expand bed capacity. As he mentioned, canceling elective procedures is a very quick and relatively easy thing to do. The next thing is expanding capacity within the existing facility by using licensed but perhaps not staffed beds. Further than that is even expanding through our executive order the use of unlicensed beds. But when space becomes an issue, then we need an overflow facility. And just as you mentioned, closed rural hospitals and other similar facilities are next on the list. And then in the extreme circumstance, we are also making a list of identified sites that could be additional overflow beds were all of those previous options already exhausted.
Quick question, just because it's different in every state, but what is the hospitalization rate in Tennessee versus people that might be just sent home?
I don't think we have enough data yet to be able to talk about that number specifically. We know that from the Chinese study of 45,000 people that were infected in China, 80% were mild and did not require any medical care. 15% required hospitalization and 5% required critical care. Again, I caution you to extrapolate too much out of the numbers we have already because the denominator is not big enough to be reliable.
Governor, I have a question. Wallace, and I think a conservative group said, are describing Tennessee as at least prepared to deal with this crisis. And Wallace basically says primarily because we're in the bottom 10, I think we're number 9 nationwide because of the number of public health laboratories and the number of tested coronavirus cases and public health spending per capita and total public emergency preparedness funding. What do you guys say about that?
I'd say that Tennessee is really well prepared for this crisis. We have sufficient testing. We currently have a strategy to provide for care, but most importantly, what we have is a citizenry who is engaged in social distancing and taking the steps necessary. We requested that schools close yesterday. 100% of them closed today. We see a movement of Tennesseans to comply with every effort to slow the speed of this disease, and I think we're very prepared for it. We are one of very few states who have rainy day funds who compare those rainy day funds with one of the lowest debt per capita burdens in America. We also have one of the lowest tax per capita burdens in America, and going into an economic downturn period, that's a state that's well prepared. We have record high funds in our state unemployment insurance funds. We have record high funds in our temporary assistance for needy family funding, and we are prepared for an economic downturn, and we are prepared from a health standpoint for the COVID-19 virus. Now, will we not have cases? Of course we're going to have cases. We're going to have significant number of cases, and because we're actually doing better than many states on testing, we may have a more rapid rise of testing of cases than other states because of the amount of testing that we're doing in this state. So I'm really encouraged by the teams from the private sector, from our health department, and from the state, and the way that they've worked together to really attack this head on. And as tragic and as difficult as it is for our state, I think we're well prepared.
Let's see one more question before we go to the phone.
Is your hotline fully functional now? You've had some folks calling and say the waiver time is really bothering you.
Yeah. No, it's not fully functional. It's fully functional, but it is got so many people calling it that there's a wait line. So we're actually opening up a second call center, and you can address this. That's going to have 50 lines, and we've secured 25 volunteers on Friday to serve in this new line that we'll have up in 48 hours. So the good news is people are calling in for information. The bad news is that the numbers of people calling in are more than we anticipated, but we're ramping up rapidly to make sure that we can provide information to Tennesseans.
Are there any data on how many people call?
Do you know?
Yes, we're getting several hundred calls a day, and in full transparency, we've also got about that many on hold. And so we took the definitive action of saying, you know what, we need a second option. And so we are rapidly deploying that second option, and that will be in addition to the current. Just quite frankly, the demand exceeds the capacity, and we're addressing that definitively.
How many calls did you say you're getting?
The last numbers that I saw were in the 900 range a day. And obviously that's 900 completed calls, not the ones that didn't get through, unfortunately.
Are you considering?
Hold on, excuse me. We're gonna take questions from the phone now, and we're gonna open it up on the phone line. If you'd be able to identify your name and your outlet, and then we'll be able to answer your questions.
This question is related to our students K through 12. One of the issues facing the legislature before recessing this week is addressing required state TN-ready testing that's scheduled to happen in our schools in mid-April. With schools closing statewide, Commissioner Schwinn has requested a federal waiver related to testing and working with the legislature on this issue. Can you go back to the legislature?
Can I what? What was the last part of that question?
Or even the latest of this year.
Marta, would you be able to repeat that last bit?
Repeat the last part. You mentioned that Commissioner Schwinn had requested a waiver from the federal government.
Yes, and it's working with the legislature on developing legislation to address this issue. And my question is whether the legislature, if you can speak to whether the legislature will move this week to scrap TN-ready tests for 2020, and also to soften or even gun-related accountability systems this year that are based on those tests.
Well, we're, as you know, and actually what I said yesterday around school closures was the first thing to do is get kids safe and get them fed, and we've done that. But the second thing to do is then to approach issues around funding for our BEP around federal requirements regarding assessments and testing and number of days that children are in school. Those are all issues that are urgent and that we are on top of and working on, but we don't have answers on any of them yet.
Thank you.
Hello, Governor. It's Natalie Allison, Tennessee. I have a couple questions. The first of which is, are you all planning on dipping into this large TANF reserve to fund this increase in cash benefits? I know you've referenced the reserve, but you haven't directly said whether that's going to be a way you're going to fund these increased benefits.
We are. That is where the funding will come from for this, for the TANF funding that I outlined just a few minutes ago. What we're doing is lessening the restrictions around TANF, which will make it easier for folks to access those funds, but they are coming from the reserve.
Do you have any estimate on how much of the reserve you all are going to be using this year in the COVID-19 economic downturn?
You know, it's a good question, and we actually have been trying to run a couple of models. It's very difficult. It's very difficult to model because no one has any idea how fast, how long this downturn will last, how deep it will be. Certainly 2 weeks ago, we had no idea that the impact economically that we might see from COVID-19 would be as severe as it was, or that the reaction to markets and to businesses would be so strong. So we're trying to model different scenarios, but I can't give you an answer on that now. What we're actually trying to do is make certain that we don't deplete those funds at a rate that is not helpful for the future. So we do that by temporarily lifting restrictions and then watching the actions that follow as a result of the downturn.
Okay, and then my other question is, what about all the people who are uninsured, who inevitably will need treatment, maybe a doctor visit or hospitalization due to COVID-19? I know you all said, of course, testing is free for anyone who needs it, but are you all considering at all any kind of expansion of Medicaid right now?
Well, what we're interested in is how people can receive treatment for COVID-19, and even those that are unemployed. There are a couple of approaches to that, and one of those is funding through Medicaid that allows specific targeted treatment funding. But the other one is through what we call our healthcare safety net. And what you'll see in our proposed budget to the legislature tomorrow is a significant increase in funding for the healthcare safety net that will, and those, as you know, are clinics, federally qualified health clinics, faith-based clinics, community clinics that provide care primarily for the uninsured all across our state. And in anticipation of medical needs, particularly around COVID-19, for uninsured, we will be partially funding those through the safety net. So we're thinking of and exploring multiple opportunities to provide health care for the uninsured that as it's related to this disease.
All right, we'll take a couple more from the room.
Are you considering this economic injury disaster loan program that I believe 6 other states have enacted?
Well, what we're doing is talking and communicating regularly with the federal government over on all of the programs and subsidies that they're offering. Those are changing daily, and the announcements change daily. So we have created an office within the governor's office to stay connected to and work with and receive information on and apply for, as appropriate, every opportunity for funding that makes sense for our state.
So that's something that comes down from the feds.
Which funding did you?
Economic injury disaster loan program.
Yeah, that's not a state program. That's a federal program. As far as I know, it's a federal program.
Are you looking at it?
Well, I don't know if we're looking specifically at that program. We're looking at every program that the federal government's offering to the state and determining whether that's necessary or not. And I'll make one other comment about that. Because we have been very fiscally responsible for several years in our state, we don't anticipate needing to borrow money from anyone to pay for the services that we want to provide to those in need. Again, we have prepared for this day, and we certainly never wanted this day to come, and we didn't know it would come this severely, but we're prepared in this state in ways that many other states are not. A lot of states have significant amount of debt already, and so they'll need to borrow money to provide additional services. We are a state that is very unusual in that we don't have debt. It's one of the things that we're very grateful for in times like this. Not only do we not have debt, but we have surpluses, and those will allow us to not have to borrow.
Governor, my understanding is that some of the flexibilities you're looking for with TANF will require some federal approval. Is that the case, and have you gotten federal approval for what you're trying to do at this point?
We've gotten federal approval for parts of what we're going to do, and Danielle, would you like to comment? There are things that we're requesting through TANF, and why don't you make more specific comments? That it's kind of a half and half answer.
Thank you. Basically, for the program that we would be rolling out as a result of this, it does not require additional federal approval. What the governor mentioned was doing emergency cash assistance, and that is a program that we within the state are within our ability to create ourselves, and we do not need that additional approval.
We are waiting, are we not, on SNAP benefits, which work with our efforts towards SNAP. You can make a comment about that.
So SNAP, our Supplemental Nutrition Assistance Program, is a little bit different, and that one does require additional federal approval, and that one is currently traveling with a bill that is traveling through Congress now, which we anticipate having. That is not something the states have the ability to control or regulate through any portion of that process for eligibility, and we won't have any further guidance on that until that bill passes through Congress.
At this time, that's all the time we have for questions. Governor, do you want to make a closing statement, and then we'll wrap up?
No, I just thank you for being here, and we'll be back here tomorrow. We'll talk about other work that we're doing. We want to again get as much information out to Tennesseans, make them understand what it is that we're doing, recognize the preparedness that we put in place, but understand the challenges that we face together. And at every opportunity that I have, I'm going to encourage Tennesseans to engage, to help their neighbor, to participate in helping saving lives in Tennessee by following the guidelines that we and others give you, by helping not spread this disease, by doing all the things that are requested of you. It really does matter what you individually do, not so much with regard to the disease and how it affects you personally, but how it affects Tennesseans all around you. So appreciate everyone out there, their efforts in helping us work together to slow this disease. We'll be back again tomorrow.
All right, so you've been listening to Governor Bill Lee in Nashville talking about the plans the state is putting in place to help ease the impact a lot of you may be feeling because of COVID-19, everything from grants for local governments to child care, even the Unemployment Insurance Trust Fund. Heard a question a moment ago as far as schooling. A lot of you have questions about, how are my kids going to make up these days? How many days are we going to be required for them to move on to the next level? TN testing as well. He says that is something that they are right now working on. Now, Governor Lee, as you just heard, expected to give updates throughout the week. We're going to continue to bring those to you live right here on WATE.